Okay, I want to talk about orgasms. I'm Jill Angelo, host of the Geneve podcast series for women's health in midlife. I speak with the most forward-thinking experts in the health and wellness industries. These experts are helping women 40 plus feel confident and in control of their health in the most vibrant years of their lives. So join us on this journey of women's health.
As promised, this is part 2 of my conversation with your doctor for all things down there, Susie Gronski. In part 1, which you can hear at geneve.com, we talked about the pelvic area, where it is and what it does, and some of the common problems women and men experience in that area. In part 2, we talk about pelvic pain and how to treat it, including how to get your orgasms back. Dr. Susie approaches treatment from a holistic perspective that takes into account the whole person, not just their midsection. It's about teaching patients to care for themselves, Dr. Susie says, and it makes for a fascinating conversation. Thanks for joining us.
If someone is having pain in an orgasm, how do you really help them manage through that? Because so much of it's mental.
So orgasms, fun topic. Love them. They're healthy. They're good to have. But if they're painful, you're not going to want to do it, right? So for women especially, I think perimenopausally, menopausally orgasms can be quite difficult to attain due to the decrease in libido. You want to have it to begin with. That's like the sexual arousal is half the battle. The other thing is tissue health and hormone balance, right? So perimenopausally, menopausally, there's a shift in hormones, and it depends on lifestyle and dietary factors and movement and physical exercise and genetics as well for a woman. But vaginal dryness is usually the main complaint, and also tissue atrophy, where the tissues, because of the decrease in estradiol, the tissues become thinner, weaker, the connective tissue around the clitoris and the muscles around the clitoris, because there are muscles that aid in sexual appreciation, which are your pelvic floor muscles, that kind of connect to the hood of the clitoris. So stimulation can either be very pleasurable or it can be not so fun. And so we have to look at, like from my perspective, I have to look at the tissue health and integrity and increase blood flow to the area, which is usually through connective tissue work, soft tissue work, relaxation of those muscles and stretching, and very much so, like if someone had pain anywhere else, it's down training the nervous system, because for an orgasm to happen, you have to have parasympathetic stimulation, which is rest and digest, right? It just makes sense. If you're scared or if you've got a lot of stress on your plate and you've got the kids screaming in one room and spousal issues or partner issues, the last thing that's going to be on your mind is wanting to have sex. It is oftentimes of, how calm are you? How happy are you? How relaxed are you? How balanced is your life? And so I have to look at those things with my clients. I have to say, everything that you put on your plate is because you said yes to it. So what can we do to say no? What can we do to optimize your overall health? And once we get, stress hormone levels regulated, the adrenals regulated better and more resilient. Once you're physically more resilient, your body and mind are also going to be feeling the benefits of what's going on. And so now we're only not tackling the physical aspect, but we're also boosting the healing from within from a physiological perspective as well. And psychological perspective. So it's a very complex answer and not even a full answer, but it's just an overall scope of, where I would go with someone like that. And if there's any other, either dietary, supplementary, suppositories for vaginal tissue health, that sort of thing that might help. But that's where I would kind of start to put the puzzle pieces together for someone. And it's so individualized. It depends on their story and how deep they want to go and what if it's even a desire to have sexual intercourse, and then using toys are good too, especially perimenopausally, menopausally. You might not have ever explored that idea, but there's so many great options out there to help with safe stimulation, positive stimulation, and not associating with something very negative. Because you're right, Jill, people will say, oh my gosh, it was painful, I had a bad experience, and all it takes is one experience to shape the rest of your life. So it gives me goosebumps just saying that, because we have to really be careful with, as a practitioner, I'm very careful with the words I use. Words can also be very traumatizing, and my actions and my body language. So again, creating more of a safety environment around, and a positive experience around orgasm and sex. And, you might not be right away gung-ho to have intercourse, but how can we bring pleasure and intimacy back into your life without associating with something bad?
Yeah. I that's just incredible to even think that can be an option, I think, for people who have gone through traumatizing situations, or who have experienced that kind of discomfort in that part of the body, which is just so personal and so sensitive, and such a place of pleasure, but also, a really, really sensitive part of the body. So now you have a kind of a 6-day course, correct? Tell us a little bit about that.
So the 6-day course is a hands-on training course. It's essentially your own personal classroom. So it's not a group setting. It's a one-on-one setting. If someone wants to really know the ins and outs of how to treat themselves. So first it'll be an assessment. I go through a full comprehensive assessment, head to toe, the whole health map and a functional integration kind of thing. And then we go through, okay, I'm going to have you explore your body, and I'm guiding them, but I'm essentially teaching them how to do an assessment on themselves. And I'm bringing awareness to, do you feel that? How does that feel? Do you, breathe here? And essentially just teaching them to come back into their body, to feel things without necessarily having to see things, because genital work, you're not always looking at your private parts. And for women, our genitals, it's all on the inside, most of it, except for our clitoris and labia. Guys have it easy. They have dangly bits from a musculoskeletal, but we all have the same parts, essentially. It's just genitals look differently, but the muscles are still the same. We have a uterus, they have a prostate. Hormonally, we're different. Of course, we have more of certain amounts of hormones, but essentially the function is still the same, and the way I teach is still the same for men and women. The techniques might vary because, again, we have an extra hole. Being a female, we have an extra hole, and guys don't. So it's teaching them what these muscles do, what they look like, the anatomy, and then treating it. So after they find all these points or tenderness or what have you, after we kind of extrapolate some information, then we go into treatment. And treatment definitely includes the brain on pain aspect. So that's day number 2. It's a whole day just devoted to educating someone on pain and understanding where pain comes from, and we shouldn't be afraid of pain. And then how to calm extra sensitive nerves and all that sort of stuff. And mindfulness-based reduction strategies. Sorry, that's a mouthful. To help with calming down the nervous system and meditating and all that sort of thing. And then breathing and how to release your own diaphragm and stretching and myofascial work. And so they learn how to pretty much do it all, and I'm just their teacher to guide them through how to make modifications, what if it doesn't feel right, what to do then, and then how to progress. So really it's wherever they want to take the course, there's a structure to it, but I'm certainly not opposed to veering off the path, because everyone's so different. And so I think that's what makes this program so unique, is that I do go into a coaching type relationship with them, where I can essentially look at their entire life and their health map and life map and say, hey, this is the pattern I'm seeing. How far do you want to go? Do you want to explore this or that? And what's your next step? And we create action plans. So I empower them, really. I empower them to be able to take their health into their own hands. No pun intended. There's so many puns in what I do, I swear. And that's the whole gist of the program. And they get all the tools, they get all the products that they need to help them. So I help get rid of some of the procrastination. Here's your tools. You got it. You're all set. You rock on. You do it. You can do it. Fly. And I want them to have wings, and I want them to fly. And then they always have the support from me after their program. I think it's very important. I think transformation and change in general is very important. And you need to have support, a web of support, whether that's from family, friends, furry pets, nature, you name it, but having a support system that you can rely on to help you stay accountable for your goals and to, just for someone to talk to when you feel frustrated and alone. Because it can be quite daunting living with persistent pain. And I just want them to know they're not alone and they have support, and we're just going to kind of continue on that path.
Work through it together. And is the 6-day program, is it a face-to-face program, or is it, can you do it virtually?
Part of it is virtually, especially if they're seeing me out of state. So the first conversation is an exploration call, and I get their whole history, and then I create this whole coaching plan and vision for them, and then their program is tailored to them. But essentially, the 6 days are one-on-one in person. Yes, because I have to physically be there to. It's an experience to have someone touch you and to say, do you feel that? And then take their hand and my hand, and I use my hand over their hand to say, I want you to feel what I'm feeling. I want you to feel the pressure and the depth that I'm working at, so that they can essentially learn how to use their hands like I do as their own therapist.
If you could give women, just 3 things to be mindful of in a forum like this around their whole pelvic floor health, what would they be?
The first thing would be, I think, that they're not alone. Oftentimes we feel like we're the only ones that, leak when we're in Zumba class, or that it's quote unquote normal to have incontinence after having a baby, or as you get older. So oftentimes the misconceptions and myths that I hear, it might be common. It is very common, but it's certainly not normal, and there's help for that. So I think number 1 is just being aware of that you can certainly help yourself. You don't have to wear pads for the rest of your life. Even in menopause, you thought you were done with them. I think the second thing is knowing that it's multifactorial, that it's not just doing kegels all the time. I think doctors and there's a lot of hype on the internet about strengthening your core and doing pelvic floor kegels is going to help with incontinence, and it's not always a kegel issue. It's not always a strength issue per se, because oftentimes, and this is what I see in my office, is the muscles are weak and tense, so they can be overactive and tight. So if you try to contract, like you cough or sneeze or jump, those muscles will no longer, there's no more room for them to contract to squeeze around the tubes that empty your bladder or your bowel. So sometimes you need to downtrain before you can uptrain and strengthen. So be very conscientious that if you're doing a core strengthening program and it's not working for you, get a professional opinion so that someone can really tell you what's happening with these muscles. And it's not just what's happening at the pelvic floor level, but what's happening at the rest of the body. Again, are you gripping at your abdomen, or everything around the muscles around your ribs? Are you tightening? Are you gripping? And that certainly changes pressure systems in the body, and that can create repetitive stress and strain through the pelvic floor. So I think those are the 2 main important things I think to be aware of, and not to be shy to talk about or to get help for these issues, because even if your doctor doesn't ask you, you should just bring it up, because there are practitioners and medical providers that just forget to ask, like, how's your sex life? Are you peeing your pants? Are you going to the bathroom 20 times a day? That sort of thing. They just don't ask. And I think it's up to our own individual responsibility to say, hey, this is really impacting my quality of life, especially for women, their sexuality, their confidence, their social interaction. I can't tell you how many times women will stop going to their favorite concerts or hanging out with friends or taking walks, that are longer, and hikes, because they're afraid they're going to have an accident. It's just sad. And so I want to empower them to get over the vagina phobia and be very vocal about it, because you're not alone. So we're in this together as a community of sisters, and the sisterhood is very much strong, and we are stronger in numbers. So.
Oh, that's such an uplifting way to think about such a kind of an embarrassing part of the body. So you just kind of make it okay. So thank you for that. If people want to find you, where do they find you?
My website is the best place to explore what I do at www.drsusieg.com. It's SUSIEG.com. They can also connect with me on Instagram and Facebook at Dr. Susie G.
And, you know, I just would encourage anybody just to go out and check out your website. Like, it's entertaining. You are fun. You put a sense of fun to a tough topic, and you make it okay. And I think that's half of it, more than half of it. So, God, thank you for what you do. Thanks for spending some time with us today. And, here's to pelvic floor health, and just, happy private parts.
Happy private parts. I love it. Thank you so much for having me on your show, Jill. Thank you so much. And thank you to all you listeners.
So we have our orders from Dr. Susie. If you're having pelvic problems, don't be shy. Bring them up with your doctor so you can get the treatment you need. Great advice, and thank you, Dr. Susie. Up next, I talk with Jennifer Mason of Vitamin Chi on acupuncture and your fabulous fascia. I'll see you soon.
Thanks for listening to the Geneve podcast series. We welcome your feedback at geneve.com. That's GENNEVE.com. You can follow us on Facebook and subscribe to us on iTunes or Stitcher, and you'll never miss an episode. The Geneve podcast series is produced by Shannon Perry. Theme music by Smitty. And until next time, watch the Geneve website for new stories and offers, all dedicated to women's midlife health.